afternoon to those who are in their afternoon, and early good morning or good night to those who are in a different time zone. Okay, David made the introduction already, so I think I can slowly proceed. My name is Jonathan, and I come from the island of Malta from a private company called MECB Limited. It's for me to be here addressing you in this interesting conference on health workforce education and research, precisely because what I'm going to present is very aligned with the topic of the conference. Okay, as you can see from the title, it says a digital VET toolkit for promoting the fourth industrial revolution in the health sector. So for my presentation, I'll be taking you through these more or less stages. We'll have a look at the problem background. In this case, why we need to address the fourth industrial revolution. And I'll then pass on to present a bit the outline of the project itself, which is called Digi4Health, and discuss also some emerging results. The project is still ongoing. It's a 24-month project, but there are some results coming out, so we can actually start having a look at these. And of course, I'll pass on to make some conclusions later on. Okay, so problem background. Well, as we know or might not realize all the time, there's a silent revolution going on around us. It has been going on for a number of years in different sectors, and this concerns the digitization. I'll start off with nothing related to the topic of today's conference, but for instance, a few years back, if one had to go to a restaurant, you'll notice that your order was being taken by waiters or waitresses by a piece of pen and paper. Nowadays, this has changed, and we are more likely to see your order being taken digitally through some device or tablet, which also meant that workers in this sector, for instance, had to be trained to catch up with such technologies. Especially those who were of a certain age, it doesn't mean it was easy for them to catch up. Similarly, if, for instance, one checks in for a flight, we have increasingly seen in the last few years that in certain airports, you are likely to find automated check-in systems intended to help, increase the flow of people. In reality, sometimes you get some individuals who are actually perplexed on what to do and how to proceed to check in. So the technology actually being put over there was not actually being helpful for everyone. Again, this meant that people need to be helped in catching up with such technology. Now, this revolution is taking place, of course, not only in catering or in aviation, but around us in many sectors. And it's what is known as the fourth industrial revolution. And this revolution is actually having an impact on life and work practices in various sectors. And precisely why we need to address this also in the health sector. Besides manufacturing, from where this concept of Industry 4.0 actually commenced, now we are seeing that the use of emerging technologies is being used both in the private and public sectors across a range of industries: health, construction, agriculture, etc. Of course, today we are here focusing on the digitalization going on in the health sector. Okay, but that is just an overview of what's happening and what has been happening around us, and is likely to increase. Now, when we say the fourth industrial revolution in the health sector, this is because a number of digital technologies such as sensors, AI, augmented reality, virtual reality, 3D printing, data analytics, etc., they're also finding their way in the health sector. They are, and they will impact health sector work practices and services even more as time passes by. And what this also means is that workers need to be assisted to catch up with such technologies. Of course, a number of health sector individuals are already familiar with certain, let me say, technologies, but there are still a large percentage of individuals who still need to catch up, especially with certain types of technologies. This has been also reported by a report done by KPMG, which is showing the trends going on till 2030. And of course, the digitization is going to have an impact in a number of areas of the health sectors. One is to, of course, be a bit careful, because sometimes we also see a lot of hype in terms of technology. And luckily, there's what is known as hype cycles, and one can also have a better idea of what is still hype and what is more maturing. Okay, so we are aware that certain technologies might still be in their hype cycle, others might be still maturing, and others might be actually already being taken up. With that background, however, we can now confidently say that the concepts of Industry 4.0 are actually being exploited by the health sector, giving rise to what is increasingly known Health 4.0. And sometimes we also see the term Hospital 4.0, where it has to focus on the hospital level. What this is meaning is that basically the health sector stakeholders need to be made aware and also trained on emerging technologies in Health 4.0. At the same time, trainers need resources to facilitate effective knowledge transfer related to actually Health 4.0. It is also interesting to appreciate that even the European Commission is in a way giving a strategic direction, and in fact, as outlined in the 2018 document entitled Enabling the Digital Transformation of Health and Care in the Digital Single Market, it is stated that digital solutions for healthcare can increase the well-being of millions of citizens and radically change the way healthcare is delivered to patients. And this direction itself is, of course, fostering more interest and more exploitation of digital technologies in the health sector. Now, of course, when we say digital technologies, it could mean a number of things. What we're seeing is, for instance, some means by which healthcare professionals will be increasingly supported in their work. All this, of course, aimed towards either enhancing their interprofessional cooperation and ultimately providing personal patient care. These include things like 4G and 5G mobile, artificial intelligence, Internet of Things, big data, blockchain, robotics, drones, 3D printing, virtual and augmented reality, and others. I'm just mentioning this just for now to give an insight of what we are implying when we say digital technologies. Now, all this is already being highlighted has an impact also on educators. Why? Because healthcare trainers of various disciplines, such as physiotherapy and podiatry, need to be also assisted to catch up with the range of digital technologies and advancements taking place due to this fourth industrial revolution in the health sector. At the same time, as we know, as working adults, healthcare personnel have a difficulty to find time to attend CPD courses. It might not be an excuse, but the reality is there's a real difficulty over there. Nevertheless, these workers need to be supported to learn about these technologies infiltrating the health sector, because it's going to impact how they work and how they care for their patients. So with that background, let's now pass on to discuss a bit the project which we are involved in with David and INHWE, besides others, called Digi4Health, precisely aimed at addressing this challenging issue. Okay, so what happened? A few years back, our organization, MECB, actually, because of the experience we have in other sectors with digitization, primarily starting off from the manufacturing sector, we were being increasingly also asked to provide our knowledge in terms of technology to other sectors, and we were starting to see this interest also in the health sector. And hence we came up with the concept and idea of coming up with this project that precisely addresses the knowledge transfer required to help health sector stakeholders acquaint themselves with Health 4.0. And for this reason, we partnered with a number of European project partners, including CAMIS, which is a let me say research center of the Bucharest University, Polytechnica. We have INHWE on board, which of course do make a lot of sense because of the relevance they have and interest in health workforce education. We have Kaunas Science and Technology Park from Lithuania. We have a Greek VET organization to help us with VET issues, Kairotomia, and we have a Spanish technology transfer organization called K-Veloce. And together, we discussed how we can actually come up with this project. We applied for funding, and we were indeed successful to acquire funding under the Erasmus, let me say, hat, to address this issue of Health 4.0. It is a 24-month project. It kicked off back in October 2019. We are right now, of course, somewhere over there. And we more or less have let me say, a good 9 months to go unless we do get an extension because of implications arising out of COVID. We did a lot of work in spite of COVID, but it also meant that a number of our physical meetings and exchanges and also visits to stakeholders had to be, of course, stalled because of social distancing. In any case, the work is going on, and we're slowly entering the phase where we need to do some evaluations and dissemination. The results are, let me say, starting to concretize themselves, but let me say, we are doing fine irrespective of the COVID situation. Okay, in terms of objectives, we set ourselves these objectives. Number one was to develop a curriculum targeted healthcare personnel to help them learn about Health 4.0 and, of course, the underlying technologies. We also want to develop case studies to portray how such technologies can be used in a Health 4.0 environment. For instance, how is 3D printing used? How is AR used? How is VR used? The third objective is to develop an e-learning platform precisely to allow the knowledge we accumulate to be easily transferred to other stakeholders, and also to develop a VET trainers toolkit, whereby we provide our resources, the things we develop, and make them openly available for others to freely use. Of course, we need to evaluate whether this toolkit is useful, what are its strengths and its weaknesses, so that's an objective. And last but not least, of course, to disseminate and exploit also the emerging project results. Something, for instance, we are doing today. In terms of therefore, let me say, the actual work involved, the target audience, in our case, we're focusing more or less on VET, vet trainers and mentors. So we precisely took the direction, and also because precisely our funding is aimed at VET. And what this means is that besides the trainers and mentors, we have to also address the learners involved, those who are still learning, but nevertheless, those who are already working, those who have been to the learning system, but now they are working as healthcare personnel and they need to catch up. And more or less, these are the stakeholders we are actually addressing in our project. In terms of the concept, the project is aimed at this overall conceptual framework, whereby the VET trainers and mentors would have access to a digital toolkit comprising of a number of training resources, and through that toolkit, they can actually select and make use of different resources to address the needs of their learners or healthcare personnel that need to catch up. Of course, all this ultimately aimed at providing an improved patient care approach. In terms of the outputs of the project, what are called in Erasmus type of projects intellectual outputs, we have 5 main outputs. Output 1 is the curriculum. Output 2 are a set of case studies. Output 3 is the training material and resources need to be modular to cater for the needs of different stakeholders. Output 4 is the e-learning platform, and output 5 will be the actual toolkit whereby we'll have the resources available for the trainers. All this work is actually taking place, and of course, by building up one output over the other, the cases will become input to toolkit, same thing, the training material, and of course, the e-learning platform. And the different partners have been given a lead to of course, focus on a number of outputs. We all work together, but of course, the different outputs have different leaders precisely for improved management of the work involved. Okay, I think what's now more interesting is to start seeing some emerging results of this project. Okay, the main important foundation of this project is, of course, the curriculum, because all the other, let me say, outputs depend on this curriculum. It is, as I said, mostly VET focused, which in the case of Europe, it means we are focusing more or less on EQF, European Qualifications Framework Level 5. We arrived at the design of this curriculum through a number of focus group discussions and interviews with stakeholders. Luckily, these took place before COVID restrictions came in. So we had actually been able to physically meet a number of stakeholders at this stage. And it involved, of course, a number of questions. From a high level, these concern the description of digital technologies used and required in their working context, try to identify that, the capacity identified or needed for learning and teaching, and of course, trying to identify the good practices in the field regarding different technologies. In total, we had 6 representatives in 5 partner countries, and these, of course, included vet trainers and learners, but of course, very importantly, also a number of healthcare professionals, including GPs, radiologists, dentists, nurses, occupational therapists, physiotherapists, podiatrists, odontologists, and cardiologists. Of course, 60 might not be a very big sample if you take the whole of Europe, but it gave us also a good indication of the trends and needs in terms of training required to Health 4.0. The actual questionnaire used, without going into too much detail, but later on I'll give you a link to see the actual study in more detail. Of course, we had to identify a range of technologies. As I said, there's a hype cycle. There are a number of technologies which are still emerging. Other technologies are more mature. So we had to collectively decide as a consortium which are those technologies which we should be looking at for the next, let me say, 5 years. And also importantly, we had to identify on whether the stakeholders knew about these technologies. But that is also different between knowing on that technology or being aware of that technology and rather being aware of how it can be used in the health sector. So we had to distinguish both. We had to also try to understand whether they would find case studies useful in terms of their learning or also their knowledge transfer as trainers. And we also try to identify which resources would they prefer to facilitate either learning for the learners or in terms of training for the educators. And of course, we provided a mix of possible approaches over there. Of course, what happened, we collected the data. As I said, this data collection took place before we started having COVID restrictions in the different partner countries. These are just some shots of some focus group meetings that took place. And of course, after the data was collected, we started analyzing the data, first of all by partner country, then eventually also collectively from the sample of countries we actually surveyed. More or less, just to give you some insights, as I said, the details are in the report. But for instance, if you look at over here at, let's say, for instance, I don't know, 3D scanning, one will see that the level of knowledge and or whether there's no knowledge or no knowledge was more or less the same. Okay, they knew that there was technology on 3D scanning. They knew of, for instance, Internet of Things. Some had no knowledge. On the other hand, if one had to see, for instance, I don't know, IoT and how it is used in healthcare, and they were not aware. Very few were aware. Same thing, for instance, 3D scanning, not really aware of how 3D scanning technology can be used in the healthcare sector, of course, for various, let me say, disciplines, not for all disciplines, and similarly for the rest of technologies. Based on that, we, of course, asked whether they would be willing to see case studies, and there's a lot of data which we actually captured, and the data has been, let me say, compiled into a report, and we designed a curriculum, very detailed curriculum, which more or less, if one had to see the overall result, is a curriculum based on 7 units, which you see briefly over there, and for each then unit, we also specified a number of things, such as, for instance, the number of hours that we should invest over there, the typical competencies we need to achieve by the end of the training, etc., etc., for each and every unit. Of course, that took place for all the study units, and based on that, then we started passing on to developing the other outputs. So, for instance, for case studies, I don't know, if you look at, for instance, 3D scanning, we came up with case studies. The aim of a case study is simply to motivate the learner and the healthcare worker to get interested in some digital technology before delving deeper into learning. So the idea here was to be brief, but briefly motivate them to then learn more. So these are more or less A4 flyers, which they can print out or see on their mobile phone or tablet. And they can very quickly, through a simple A4 flyer, get to know a bit more about that specific technology. A number of these case studies actually also supported with augmented reality itself. And I will try to give you a demonstration. Hopefully it will show at your end too. So for instance, over here, we will see that through a mobile device, once the user actually scans the flyer and certain positions, the user will start getting certain augmented reality experiences. In this case, you can see there's an example of feet showing up over there. The sheet of paper can be turned around to study, to investigate, I don't know, to be used for training by learners or even by professionals who want maybe to explain something to their patients, just through a mobile phone. And this, as you can see, becomes possible. Not only that, but the same actual flyer, the same flyer you can see over here, would have also more embedded information. So again, on the same flyer, but this time focusing on different part of the flyer, you will see, for instance, you can read more, you can see a video on how, I don't know, to make a 3D scan. Apologies, is actually showing at an angle because of the way it was captured, but it's just a small snapshot of course, it can keep on going for long, of how, for instance, that 3D scanner can be used to scan a human being. So as you can see, these flyers are intended to precisely to tease a bit the individuals to actually, let me say, get to learn more. Okay. Besides AR, we have also made use of virtual reality. Some examples, some cases are in virtual reality. This work is still ongoing. I'm showing you some emerging results. The problem with VR in terms of education is one can make use of cheap headsets or very expensive headsets. But as we know, if we really want to reach out to both the learners and sometimes also to certain training institutions, we cannot always go for the very expensive VR headsets. So one has to go somewhere in between. And what we are developing precisely is, let me say, case studies that can be used either by a cheap, let me say, cardboard type VR headset, or even something more complex. I'm showing you an example over here of what has been developed so far. This is, for instance, the view one could set. It's just seeing, in this case, the web page so far of the project. So that's the web page, Digi4Health over there, and one can scroll and, of course, start getting access to certain information. So, for instance, if one had to, I don't know, want to know a bit more about the partners, again, so far it's like a simple web page, but through the VR headset, one can see the information on the different partners, including, for instance, MUCB, ourselves, but also INHWE, as you can see over there, who are organizing this event today. Of course, more importantly, you can go into the actual results page and start accessing the results. And of course, you can get access to the curriculum, which I mentioned a while ago, or access the case studies. And for instance, if one had to go and experience the VR experience room, this room, we developed as an example, a room whereby it can be used both by trainers to show how VR can be used to the learners, but also by, for instance, in this case, by care workers working in elderly homes to help the elderly, for instance, experience past moments. So we have different rooms that go back in history. You can take them on a safari, on a roller coaster. We took these as examples for after consultations we actually made. And I can again show you a brief example of how this works. So through your VR headset, you can turn around and one can actually have a different view of the room, and one can select, I don't know, a sightseeing hall, historical events hall, and one can, by gazing at that icon, go onto a different wall, sorry, a different room. Here, for instance, we're seeing the history, so Beatles tour in '64, okay, or the moon landing in '69. And of course, what happens is that once you gaze at one of these specific walls, you also get the audio of that actual video. Anyway, these are just examples. Same thing, you can go, I don't know, on a let me say, I don't know, on a adventure park, you want to go to a safari, or you want to go to, I don't know, experience a roller coaster, not for us, but even for certain patients. I don't know, some people have never been on a roller coaster, and you can give them that experience. Or some are afraid to go on a roller coaster, and you want to train them on how it feels before actually going on that roller coaster. So these are some experiences you can actually make use of. These videos are actually not ours. They're freely available on actual YouTube, but we actually made use of these in our examples. Anyway, in terms of training resources, output 3, we also have what we call fact sheets, which are now different from case studies. Fact sheets are more now for the personnel. How costly is AR? How useful is AR? How much is it being used in the health sector? Okay, it's a fact sheet. Okay, it's a fact sheet collected from certain data to now help even decision making in terms of whether that technology should be introduced or not. We also have, in terms of training resources, we have developed at this stage content on the different study units, which we identify through our curriculum design and PowerPoint content, and we've also developed multiple choice questions. The content is being translated and has been translated, most of it already, in a number of languages, so it will be also available in our toolkit in due course for you to use. Instead of templates, we of course took care to make templates professional. We have also made use of female and some male templates just to keep a bit of gender balance, as you know, something that in the EU we're all the time after. These are of course some minor things. In terms of the actual content, then what happened is that the different curricula for the different study units were developed into more detailed course content, so that one can delve much deeper into a topic of everything, for instance, the 3D scanning study unit. And if I had to purposely load that study unit right now, you will see that they are well designed, okay? There's a lot of information, much more detailed objectives of this particular module on 3D scanning. It goes into a lot of detail after having motivated people on whether they should study this technology or not, okay? Anyway, this is just an example, okay? All right. In terms of the e-learning platform, work is still in progress. The content and quizzes are being translated. Luckily, we have, besides the Spanish partners on board, the Greek, Lithuanian, Romanian, we have Matteo, who's part of INHWE, and Matteo also volunteered to actually translate it into Italian. So we will also have the training resources available in the Italian language. And I think actually the training material is already available, but now, of course, we have to convert these into SCORM contents to be available on our e-learning platform, which is not really currently available right now. There's only just the external view. Okay, some conclusions before I go to make some actually demonstration data from the web page too. Okay, of course, evaluation of the results emerging still has to take place in the coming months. As I said, we are right now still developing the content. We need to eventually and hopefully will be able to do so face-to-face, do some training to test whether the toolbox is effective to transfer knowledge on Health 4.0 and to actually help stakeholders to catch up. Because it's one thing training, let me say, young ones on Health 4.0 topics, and a different thing helping those who are already working, those who are already busy working, and helping them catch up with certain technologies. And this is something we need to do in the coming months. What our studies have shown so far is that actually many have heard of different technologies. Many have heard of, for instance, AI, Internet of Things, augmented reality, virtual reality, I don't know. But in reality, a good percentage still have no clue of how these were being used in the healthcare sector. And this is, of course, an interesting aspect. So there's a difference between actually knowing that technology exists, and of course, knowing on how it can be used and for what it can be used in the healthcare sector. At the same time, because halfway through the project, we encountered this COVID pandemic, it became clear of what was happening around us through many examples we were seeing at that time, that clearly digital technology was being used for a number of things. We saw people to the printing, for instance, visors. Drones were being used to deliver certain things. Smartphones were being used to trace positive, let me say, people. So clearly, this pandemic itself highlighted even further the need to have people trained on digital technologies. Remember, the project was written before the COVID pandemic. We were only at that time actually foreseeing the increased use of digital technologies, but at the same time, the COVID pandemic actually proved to a certain extent on how useful and how important it is that healthcare sector workers be trained in these digital technologies. At the same time, we must not forget that certain services will also imply that not only the healthcare workers have to be trained on certain digital technologies, but equally, the patients will have to get used to certain digital, let me say, based services. It's like the example I mentioned at the beginning of my presentation of checking in at an airport. If the passengers are not familiar with an interface, they encounter when trying to check in, then it was, let me say, useless trying to introduce this technology, because instead of helping the flow of people checking in, it was actually creating more queues. So similarly, we have to be careful that this type of training on the Health 4.0 digitalization going on has to be also addressed for certain issues towards the patients themselves too. In terms of catching up, therefore, with Health 4.0 digital technology, it is clearly a necessity both for trainers as well as the learners and healthcare staff. What we have also seen so far is that the augmented reality and virtual reality technology, when used now for training, it is indicated that it provides a wow factor to learning and can make learning a bit more fun. At the same time, because we have happened to be now in COVID, it also allowed certain, let me say, learning experiences to be, let me say, tried out, because being physically away from certain labs makes training more difficult. But AR and VR, if used carefully, can actually offset that difficulty. It would be interesting, we have not done it because it wasn't part of our, let me say, original goal, but having seen the aim of the conference you are running here, it would be interesting to explore if the actual toolkit and the actual results embedded in the toolkit can contribute to actual team-based learning. My hypothesis is it should actually contribute, but of course it's not what I think. It has to be tested out. With that, I can also now suggest that you might want to remain up to date on our project. There are digital newsletters to follow. The resources are being made openly available, some already available on our webpage. So I suggest that you try to follow up a bit more the content being developed in the remaining months. And to do so, you might want to get out your camera or take a screenshot. First of all, there's the Facebook page over there. You can follow on what's happening. And at the very bottom, near the logo of Digi4Health, you will see our webpage over there. But I can quickly take you a bit to see a bit of what is already available on our webpage before I conclude. So of course, besides the usual disclaimers and things of the project and what it is all about and the objectives I mentioned earlier on, I think what is important for you to notice is the results. For instance, the curriculum we mentioned before, you can open it over there and you can see it in much more detail. Okay, it is actually a laborious document of the data collected, how we arrived at, the interviews performed, the actual percentages seen, etc. So you can find all this data available under our results page. You'll also be able to try the case studies, which I mentioned before. So if you have to open over there, you'll be taken to a publicly available drive. There's a guide over there of how to make use of those, for instance, AR case studies, and you'll find these in different languages. If you go into the English version over there, you will see that there are a number of case studies available, which you can therefore open, try, and print, and experience yourselves. So that would be something which you can do. And of course, if you have any feedback, we'll be more than pleased to get your feedback too. There's also the experience room over there. I'm not sure if I can open it through this link, but I'll try. Of course, you can see it without a VR headset. But if you have one of the cardboard boxes, you would be also able to see through your VR cardboard box if you press the icon over there. It doesn't show completely well in this browser, maybe right now because I'm on Zoom, but you can go into different halls, for instance, over there, historical. And you can get to see the rooms, you can turn around, you can shift, etc. etc. So these are already available. The resources are not currently available. We have an alpha version still under development of the e-learning platform. So eventually the material will be available here, but it's, as I said, currently under development because the project is still ongoing. And eventually we have the toolkit over here, we can get access to one portal to the openly, freely available resources. You can also, as I said, follow our news. Okay, we have some newsletters which come out, and they're again in different languages. There's the flyer, and of course, what's happening. Anyway, I think what is important is that you get note, therefore, of the actual, let me say, web page over there for more information. At this stage, I would like to thank you for your attention, and of course, we'll be willing to answer questions you might have. Thank you, and I look forward to any questions or comments you have. Thank you very much.